This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.
Okay, aloha, and welcome to the monthly public presentation of the Vegetarian Society of Hawaii. Since 1990, the Vegetarian Society of Hawaii has been following our mission of promoting human health, animal rights, and protection of the environment by means of vegetarian education, as we've grown to become one of the largest all-volunteer, nonprofit vegetarian societies in the nation. We are proud to say that we are celebrating our 25th birthday this year. It is now time for a special guest. We're delighted to have with us tonight Irminne Van Dyken, MD. Born in the Netherlands and raised in Montana, Dr. Irminne Van Dyken is a general and trauma surgeon who practices at the Queen's Medical Center. She completed her medical degree, internship, and residency at the University of North Dakota School of Medicine and is board certified by the American Board of Surgery. She is a member of the American Society of Breast Surgeons, the Society of Gastrointestinal and Endoscopic Surgeons, and the American College of Surgeons. Dr. Van Dyken is a passionate advocate of a whole foods, plant-based diet. She sees this as a way to prevent and treat many common maladies seen not only in the population of Hawaii, but also in the entire United States of America. Dr. Van Dyken and her husband Russell, who have been whole foods, plant-based vegans for the past 4 years, recently relocated with their dog Chaucer from North Dakota to the island of Oahu in 2014. Their successful house hunting, as well as a 27-foot boat that Russell, who's a yoga educator, built himself, have been featured on HGTV's Hawaii Life program. Their shared interests include yoga, sailing, and spending time with Chaucer. Dr. Van Dyken's presentation tonight is entitled 10 Ways a Plant-Based Diet Will Help You Avoid the Scalpel. Please join me in welcoming Dr. Irminne Van Dyken.
Tuberose, how did you know that was my favorite? Thank you very much. Wow, I really appreciate all you guys being here. It means so much to me. Thank you for your time. Thank you for coming here and just spending this hour with me. Hopefully in this hour I will really be able to talk about some very important things, and hopefully it will be life-changing for all of you guys. I chose this topic today because I feel that it is so important. So many people in our society have diseases that are preventable. Me being a surgeon, I'm well studied on how to operate, how to do very dramatic things to fix people, especially late stages of disease. But I'm here today to tell you that many of these diseases are preventable. Leading causes of death in the United States in 2014. Anybody venture number one? I'm very informal, so please yell it out. Heart disease, number one, good. How about number two? I'm sorry? Yeah, cancer, number two, big killer. Number three, chronic respiratory diseases, so COPD from smoking most often. And the rest, some very small numbers there of other diseases. 4 common diseases: heart disease, cancer, COPD, diabetes. They account for over 80% of all deaths in the United States. That's a huge number. What changed? What changed between 1900 and now? If you think about it, I have a graph on the left here. Can you guys see my pointer okay? No, you can't. Okay. Graph on the left here, what we're showing, I'm going to have to turn, I'm sorry. But what we're showing here, the green bar, that big green bar on the left, most people in 1900 died of infectious diseases. Things like TB, cholera, things that were communicable, they were spread from one to another. That brown bar underneath, that's cancer, and the blue bar under that is heart disease. If you look on the right, completely opposite. This is 2010. That brown bar, cancer, has jumped in deaths. And the blue one, heart disease, also has jumped big time. So big changes. What do you think changed between 1900 and 2010? Anybody want to venture? Yeah, diet. What else? McDonald's, good. Calorie intake. We're sitting. The other thing, we're sitting so much more than we were in 1900s. Definitely sitting. So those are some big things. If we look at BMI, BMI stands for body mass index. This is a measure of size, so a measure in general of how big we are as people. In the year 1900, you can look, we're at a BMI of a little under 24. That's normal. That's a normal BMI. You can see as the years go by, the BMI skyrockets. And when we're in 2000, our BMI is just under 28. That's classified as obese. So that's the average person, the average American now is obese. So looking at BMI, just again very quickly, you can see, hopefully, a larger BMI, obese, corresponds to a BMI of over 40, and overweight, you're looking at 25 to 29. So by this slide, the majority of people, the average BMI today is overweight in this country. Now, I have patients in my office, and I sit there and I look at them and I say, you know, what if there was a magic pill? What if there was one pill that I could prescribe for you that completely took away your problem, that cured your diabetes, cured your heart disease, cured your cancer? And these people look at me, they're very interested. They say, what pill? Yeah, prescribe it, I'll take it. What pill could that possibly be? Well, the pill really is a diet. It's a prescription for a diet, a major lifestyle change, okay? So my talk today is mostly about diet. It's mostly about things that we can do with foods to change our outcomes and our health. Two small disclaimers, and even though they're small, they're very, very important. Number one, this does not apply to a junk food vegan diet. I know many vegetarians, many vegans that are unhealthy. They're junk food vegans. Think about it. French fries are vegan. Are they healthy? Probably not. What else is vegan? Oreo cookies. Is that a healthy thing? What nutritional value are you going to get from Oreo cookies? Not a good thing. So when I talk about a plant-based diet, I'm not talking about French fries. I'm talking about a very well-balanced diet, lots of fruits and vegetables, whole grains, and that's what a plant-based diet is to me, okay? Disclaimer number two, even though this lecture is all about food, exercise is huge. They go together, hand in hand. You have to have exercise. It's additive to whole foods, and it exponentiates your results, so you're gonna get much better results if you combine those two. So, I'll talk about broccoli, I'll talk about food. Hopefully we learned something today, but you gotta remember I'm a surgeon, I operate. So what I present to you is stuff that is based on evidence. This is stuff that I haven't made up. This is stuff I haven't Googled and found just randomly without verifying facts. These are facts that I've found in the literature that are very, very important and very, very true, okay? So, that being said, I have 10 ways that a plant-based diet will help you avoid the scalpel. This is no list I got from the CDC. This is something that I made up. So if I have it wrong, it's my fault. These are my 10 things that I feel are the most important in my practice and the most important to change. So number 10, avoid atherosclerosis. So the cause of atherosclerotic heart disease, that's hardening of the plaques in the arteries. Number one killer, right? Number one killer of Americans. 611,000 deaths in 2014. This is a direct result of inflammation, cellular stress, cholesterol, and plaque buildup. Backing up just 1 second, for a personal story here, I became plant-based because I have a very strong history of heart disease. My family, I'm Dutch. Granted, the Dutch, when they cook, they throw in potatoes, meat, big old block of butter in one frying pan, and that's your dinner, and it's tasty. It definitely is, but I had a uncle that died in his 40s of a heart attack, sudden heart attack, and his sister, my aunt, also, her heart stopped. She had CPR, luckily was resuscitated from a heart attack. That's not to count my grandparents as well. So that for me, once I saw the evidence, that was my trigger to really become plant-based. So, little bit of information just about atherosclerosis, how it happens. It starts with fatty streaks. So what we have here, this is the inside of an aorta, the biggest blood vessel in your body, from a person at autopsy. And that little black arrow there, it's pointing to a fatty streak. Anybody want to venture a guess how old you are when you start getting fatty streaks, these changes in your aorta? Yeah, you're 10, 15. Your first decade of life, you start getting foam cells, you start getting fatty streaks that contribute to this disease, okay? So you have this disease, it progresses from your first decade. You can see that there. Your first decade progresses, and then you get endothelial dysfunction, inflammation. You get this buildup, this clot, which ultimately results in a blockage of the arteries that feed whatever organ you want to say, your heart, feeding your brain, all your little blood vessels in your kidneys. You get blockages, okay? So for me, well, with the exception of 2 people in this room, the question is no longer, how do I prevent heart disease? It's how do I treat the disease that's already starting to develop in me, okay? This is a heart. Hopefully you guys don't get grossed out by blood, guts, that kind of thing, but this is a heart from autopsy. This main blood vessel, the LAD, left anterior descending, it's a blood vessel that feeds your heart. It's the main vessel to your heart. It's nicknamed the widowmaker, because we get clots in there, you cause loss of blood flow to your heart, and your heart dies, and it kills people. The most common cause of death in heart attacks is this LAD, the widowmaker clot. As you can see there's a dark area, that's the clot, the dark area in the middle here. The area of infarct at the bottom, you can see the heart muscle is turned black. It's turned black because it's lost its blood supply. When we look at this when people are still alive, we do what's called an angiogram. We shoot a little bit of dye into the vessels that feed the heart. And you can see the little white arrow up there, it's pointing to a narrowing, again, in the LAD, in that little blood vessel, the widowmaker vessel. This has to be fixed, it's an emergency. You either fix it with a stent, bypass surgery, one or the other, you need to fix it. Bypass surgery, this is a picture of bypass surgery, works great, we've been doing it for quite some time. Costs about $150,000, that's the cheapest, okay? And then, once you go through this surgery, you've had your heart, your chest cracked open, your blood vessels bypassed, there's a 15 to 30% chance that these blood vessels that are brand new will clot off within the first year. So a chance you could have gone through all that and still have your blood vessels clotted off. So, fortunately, there's some good evidence regarding this. You can reverse coronary artery disease. Dean Ornish, my friend, he is a landmark pioneer. He's an MD, a cardiologist. And what he did a lifestyle heart trial. He took people that had heart disease that were too sick for surgery. The cardiothoracic surgeon said, no, I will not touch you. These were people I guess in the surgery world, if we have somebody that's too sick for surgery, for slang, we say they're not fit for a haircut. They won't even tolerate a haircut. These people would not tolerate a haircut. They were very sick, okay? He took these people, he put them on a special diet, no meat, no dairy, so 10% fat, 15 to 20% protein, 70 to 75% carbohydrates, and he restricted their cholesterol. And then after 1 year, he took a look at them again, 82% had regression of their disease. So these are people that had severe disease, they were life-limiting disease, and their disease was reversed just by following this diet. So huge, huge land-making data. Here's another one of my friends, Caldwell Esselstyn. He's the other pioneer in the heart disease world and reversing it with diet. He just published this in the Journal of Family Practice. It's for family doctors, very mainstream journal, and he's pretty much saying yeah, a plant-based diet will reverse heart disease. Start telling your patients about it. Start getting your patients to be active so that they can reverse this disease. Some of his original research quite some time ago, he took this is a PET scan, these images that you see here, a PET scan of blood flow in the coronary arteries, so the arteries that feed the heart. In the upper picture, you can see that little green area where the arrow is, that's a blockage, that's a lack of blood flow. On the bottom, this is after 3 weeks, so 21 days, not a long time. 21 days on his plant-based diet prescription, he got a complete resolution. He got new blood flow back to the heart. These are staggering results, and they change the way that we look at heart disease. Another picture maybe many of you recognize. This is a showing of the same thing just on the angiogram. So the pictures that I showed you earlier with the little narrowings there, you can see on the left, this person has pretty severe disease, a lot of narrowing. What he did, he put them on a plant-based diet for 32 months, so a little bit longer. He took an angiogram again. You can see that vessel is wide open, completely open. Looks better, if not the same, as if a stent were to be placed. So again, big results, very, very compelling evidence that plant-based diet will in fact reverse heart disease. Another study, briefly, I want you to be familiar with, because anybody who knows anything about plant-based literature is going to talk about this study, this cohort. It's called the EPIC Oxford cohort. And it is a bunch of people, over 500,000 people in Europe that they followed. They followed for years, and they broke them down into vegetarian versus non-vegetarian and vegan versus not. They followed these people for years, and they looked at what they did, what kind of problems they developed or did not develop throughout their lifetime. So this particular study basically says, yeah, there is a decrease in heart disease in people that are on a plant-based diet. This is a fancy little plot. I'm not going to go too much into depth about it, but essentially there's this solid line you see going down the middle of the slide there. Anything to the left of that means a plant-based vegetarian diet was better for you, better for preventing heart disease. They have all these factors here. Everything showed that a vegetarian diet was better in preventing this disease. So, number 9. This is another one that's very, very close and dear to me. We talked about the second leading cause of death, cancer. So breast and prostate cancer I'm going to talk about very briefly. They're the most common cancers in men and women in the United States. So this is data from 2014. We look at men, we look at women. These are new cases of cancer that were diagnosed. Out of all of the men and the women, the top 3 were, for men, prostate, lung, colon cancer. For women, it was breast, lung, and colon. So we know colon cancer is very common. It's one of the top 3 cancers. Same with the lung. And the breast and the prostate. Breast and prostate cancer are very similar. Even though one is in men and one is in women, they're both very hormone dependent. And that's something that's going to become very important. This is a landmark research paper that was published first in 2007. It's updated every year. It's by the World Cancer Research Fund and the American Institute for Cancer Research. They're very well funded, but the title of their topic is Food, Nutrition, Physical Activity, and the Prevention of Cancer. This is the first official paper with guidelines, the first paper that really came out reviewing all the evidence and talking about recommendations for preventing cancer. And what did they come up with? This landmark statement. Diet can reduce the incidence of cancers by approximately 1/3, and another third can be prevented by abolishing smoking. Wow, sit back and think about that. 1/3 can be prevented by diet, another third prevented by not smoking. It's 2/3. 2/3 of all cancers that we're seeing today theoretically can be prevented. This is a huge statement, and the beauty of it is this statement they had backed up by a lot of scientific evidence. So the same organization put out 10 recommendations for preventing cancer. I'm going to go through them quickly, but they're good recommendations and they're based on solid science. So number 1, be as lean as possible without becoming underweight. Interestingly enough, if you are underweight, that's actually a bad thing. You have a higher risk of diseases, higher risk of cancer, so you want to maintain a healthy weight. Number 2, be physically active for at least 30 minutes every day. Limit your sedentary habits. Number 3, avoid sugary drinks. Limit consumption of energy-dense foods. So avoid these sodas. These sugar substitutes as well fall into this category. Number 4, eat more of a variety of vegetables, fruits, whole grains and legumes such as beans. So plant-based diet. Can you see a theme here? It's all kind of along the same lines. Number 5, limit consumption of red meats such as beef, pork, lamb. Avoid processed meats. 6, if consumed at all, limit your alcoholic drinks to 2 for men, 1 for women per day. Number 7, limit consumption of salty foods and foods processed with salt. Okay. 8, don't use supplements to prevent against cancer. That's a guideline. So they're basically saying don't use supplements. There are some evidence that show that certain supplements will increase your risk of cancer. Better to get your nutrition from whole foods than taking supplements. There are a couple exceptions to that we'll touch on very shortly, but for the most part, try to avoid the supplements. Number 9, it's best for mothers to breastfeed exclusively for up to 6 months and then add on other liquids. And then 10, after treatment, if you're a cancer survivor, you should follow all the other recommendations to prevent cancer from coming back again. So those are the 10 guidelines, very strong guidelines, very evidence-based guidelines. So I'm just sitting here talking about, oh, this is a new thing, this is a brand new thing. Actually, it's not. This is from the New York Times in 1907. This article was published, basically saying cancer is increasing among meat eaters. Now, for some reason, this did not take off. This probably was not as evidence-based as what we have now, but it was definitely something that was long, long ago. It's not a brand new thing. Anybody know who this is? This is Neil Barnard. He's from North Dakota, where I did my training. And he's also done some landmark research, really published a lot about applying nutrition to prevention of many diseases such as cancer, diabetes, high blood pressure, kidney disease, etc. And what he's saying about cancer in general is that basically you follow a plant-based diet, you will reduce your risk of many cancers, not just one, not just breast or prostate, you will reduce many other cancers as well. So moving on, breast cancer, we know it's the most common cancer in women. 1 in 8 women will get it in their lifetime. Most cancers are hormone dependent, meaning many of these cancers, when I remove them, we send them to the pathologist and we test for hormone receptors. We test to see whether they're responsive to estrogen, to progesterone. The majority of them are. What does that mean for us? Well, we can limit the estrogen that we supply these tumors. Estrogen and fat, adipose tissue, fat cells have a very close relationship. Fat cells contain a form of estrogen that can be converted and can feed your tumors. So it's only natural that research shows that people that have less fat tissue, less adipose tissue, have a lower incidence of breast cancers. So more papers, I'll be showing you a lot of these tonight. This one is talking about reducing the risk of breast cancer nutritional strategies. And there's another one. This one I find particularly interesting. Remember those guidelines, the 10 that I showed you, the bullet points for preventing cancer? This paper is studying that. They're basically saying, they're taking a look at people and seeing how well they adhere to these guidelines. Does it really make a difference for cancer prevention? And another paper, similar type of study. And what they found is yes, as a matter of fact, it does. People that follow 5 of these guidelines, they reduce their cancer rates by about 40%. And if you add more on top of that, you're going to reduce your rates of cancer even more. So the more of those guidelines you can follow, the better you're going to be as far as preventing cancer. One other thing, talking about exercise. So exercise is huge. There's a lot of new research going into breast cancer survivorship and what we do about it, how we prevent breast cancer from coming back after surgery for breast cancer. This is a paper that was recently published talking about boot camp. So we've all heard of boot camp. You go, you exercise, very intense workout, and they've actually studied it as far as breast cancer prognosis and of breast cancer coming back. So complicated graph here, but Ki-67 is another one of those markers we look for in breast tumor tissue. Ki-67, if the percent is high, that means you have a more aggressive breast cancer, a worse prognosis. And if the Ki-67 is low, that's better. So what we're showing here is basically people that went to this boot camp had a lower Ki-67% after they went to boot camp, meaning they had a better prognosis with their breast cancer. Big research. We're changing the molecular genetics of this cancer molecule just by going to boot camp. And then we look, remember I said everything is tied to your BMI, your obesity. Here we look at the BMI before and after boot camp and the controls. And the ones that got a lower BMI, that lost weight, were the ones that saw the results with the prognosis of the breast cancer. So this study came out of Texas. Do you think there's anything like that here in Hawaii, little Hawaii? There absolutely is. At our very own University of Hawaii, we actually have a study on hula in breast cancer survivorship. And we just closed to accrual, and we're going to be starting to look at all the data points from this. We're going to be following these women who have had breast cancer, had their treatment, and we're going to follow them with this hula training and see if they actually have a decreased recurrence. I'm going to be very curious to see what we find from this study. So moving on to prostate cancer, most common cancer in men. It's very slow growing, but it's very, very common. I say refer to the data on breast cancer, and the reason why I say that is prostate cancer is also very, very hormone respondent. It responds to any hormones, the estrogens, the testosterones. These are things we want to minimize, and again, they're linked with BMI, okay? So Dean Ornish again published another paper talking about lifestyle changes in the progression of prostate cancer. He did the same thing. You'll see the same theme over and over again. He takes people that have some disease, he gives them some sort of dietary change, and then he follows them and sees what happens to the disease. So he did that. And what we have here, a fancy graph. The one on the left, that SAD, the Standard American Diet, showed only a 9% improvement in the prostate cancer growth. If you look on the right, the Ornish plan, so that's the plant-based whole foods diet, showed a 70% improvement in the cancer cell growth. So we know from this paper and from many others that there are very many dietary changes that we can make to improve prostate cancer survival. So again, data strategies, I'm always about the data. What does the data show what we can do to prevent prostate cancer? Big one again, eat a whole foods, plant-based diet. Antioxidant have a lot of phytonutrients that have been shown to prevent prostate cancer. Cooked tomatoes, the lycopene in cooked tomatoes, that can decrease your risk of prostate cancer by 35%. Yellow and orange vegetables, so the carotenoids, things that are bright yellow, also decrease your risk of prostate cancer. Next, get folic acid from whole foods. Not supplementing. There's very many studies that show if you take a folic acid supplement, you actually have a worse outcome when it comes to prostate cancer. So make sure you get it from whole foods. Avoid fried foods. Next, exercise again, at least 3 hours a week. People or men who reported vigorous activity for that time, they had a 61% lower risk of death from prostate cancer. 3 hours a week. That's not very much in the grand scheme of things. And then lastly, this is one of the exceptions to the supplement rule. There's a few studies that show that zinc supplementation can actually improve your outcome with prostate cancer. Number 8, avoid colon cancer. Anybody seen a colon cancer before on a picture? This is what it looks like. So your colon is usually this beautiful, nice, round thing. And when you have this colon tumor, the thing that you see kind of in the upper left of that, that's the tumor there, okay? It's a big problem. Every colon cancer of that size requires surgery. So if I can get you guys to avoid surgery by modifying your diet, that's great. More studies, lifestyle modifications, colorectal cancer. There's a very strong link between red meat and processed meat intake and colon cancer. That's one of the strongest associations we have, with the exception of smoking and alcohol intake. Smoking, alcohol intake, red meat, all very strongly associated with colon cancer. Another study showing exactly the same thing. They're saying high intake of red and processed meat is associated with increased risk. So the evidence support limiting the intake of that. How does this happen? How do we know? What is the connection, molecularly between red meat and all these cancers? Well, these are the plausible mechanisms. They haven't really narrowed it down to one. But one of them, they think heterocyclic amines that are released when you barbecue your meat or you cook it at a high temperature, that's actually a carcinogen, and they think that that can promote the DNA mutations. And then next, you have endogenous formation in the GI tract of N-nitroso compounds. These are carcinogenic. The Interesting thing about this one is there's a lot of new research coming out about our gut microbiome, which means the bacteria that we have in our colon. And a lot of these bacteria can metabolize all these chemicals and turn them into the nitroso compounds, which are carcinogenic or not. So we're finding that many people have different bacteria that do this metabolism or not and can result in formation of colon cancer cells. So very interesting, brand new research on that. Other strategies, I'm going to touch on all these briefly because there's such good evidence about it. I find it very fascinating. So number one, fiber. We know fiber prevents colon cancer, but did we know that it prevents it by 50%? That's cutting your cancer risk by half if you can intake fiber. Fiber has a lot of anti-cancer phytochemicals. You have polyphenols, carotenoids, all these other things. They're all present in leafy green vegetables, whole vegetables. That EPIC study, the Oxford EPIC study I talked about earlier, this is another factor they looked at. So they took all these people and they looked at colon cancer in 500,000 people. They found that doubling your fiber consumption decreases your incidence of cancer by 40%. So fiber is very good, is the bottom line for all those studies. Moving on, B vitamins. So B vitamins alter your DNA transcription. They alter how your cells divide. Okay, all of this numbers up here, it's very scientific jargon for the metabolic pathways that describe formation of cancer cells. So a high intake of folic acid reduces your risk of colorectal cancer and adenomas. What's important, and I want you guys to take away from this, is this association is only correct for natural folic acid intake from your diet, not for supplement. They actually took a look at folic acid supplements. If you take 1 milligram a day, it's harmful. It causes a 2.3-fold increase in your number of colon adenomas, which is a pre-colon cancer. So again, supplementation, folic acid, not a good thing. Whole foods are much better. Grapeseed extract, briefly, another very powerhouse as far as nutrients are concerned. Again, shows that it prevents apoptosis. It induces apoptosis, which is programmed cell death. So this is very, very important when it comes to cancer cells and killing them off before they divide into a huge tumor. Psilocybin, that comes from milk thistle. I don't know if you guys have heard of milk thistle teas, herbs. Very, very good for you. Also, it's chemopreventative. It targets DNA right at the source when it is mutating, and it inhibits that. It's also anti-inflammatory, so this is something that's very good to incorporate into your diet. And the other thing about it too is it's not toxic to your normal colon cells. So it's not going to hurt the normal cells that you have, but it will prevent the colon cancers from happening. Anybody know what this awesome molecule is? No takers? Turmeric, curcumin, or olena in Hawaiian. It's an exceptional antioxidant. This is one of the superfoods. If I could buy stock in any food, this would be it, because the research on it is huge. So it promotes apoptosis, it inhibits DNA mutations, it inhibits cancer cell dividing, metastasis, and it's also a powerful anti-inflammatory. So how does it work? Again, a whole lot more scientific jargon here, just talking about every little molecular pathway that it alters or inhibits. It's a very, very powerful supplement. Now, by supplement, I use that term loosely. This grows in your backyard. This grows here. We are so lucky to live in a place where we can just go pick it and put it as a whole food into all of our meals. So molecular targets of curcumin, it's overwhelming. Look at all these little DNA pathways they've found that curcumin inhibits. It's an overwhelming, very exciting compound. So curcumin, in summary, seems to be one of the most promising, widely available chemopreventative agents. Okay? And it's not only for colon cancer. Curcumin, look at all these areas that it has been shown to actually help. So you have wound healing, cardiovascular disease, you have Alzheimer's, epilepsy, all sorts of things. So this is one of those you want to remember from tonight's talk for sure. One more compound here. Any takers on what this one is? Yeah, Camellia sinensis is green tea. Okay, strong antioxidant, prevents reactive oxygen species. So it prevents growth factors, okay? And it induces apoptosis. So another one, very good. Lastly, I cannot talk about colon cancer without talking about alcohol and tobacco. These are the two very main big things that cause colon cancer. So if you consume 30 grams of ethanol a day, you increase your risk of colon cancer by 1. More than 45 grams, you're going to increase it to 1.4. So big promoter in this. And why does this happen? Long-term alcohol consumption, it decreases your absorption of the B vitamins. Remember how we talked about B vitamins, folate, preventing cancer? If you can't absorb your B vitamins, you will have more DNA changes, more mutations towards cancer, okay? And then tobacco, of course, you have all these direct carcinogens, aromatic amines, nitrosamines, heterocyclic amines. These are all direct carcinogens. They cause direct cellular damage. And of course, the last one, physical activity. So most physically active people, they have a 24% lower risk of colorectal cancer development compared to people that sit around all day. Probably again, due to decreased obesity. So something that we have to remember, we have to keep active, okay? So, number 7. This one encompasses the other ones. They're all interrelated, as you'll see. I can't really talk about one thing without talking about the others. So 7 is avoid obesity. When we look at obesity and your relative risk of cancer, with females, if you're obese, your risk of endometrial cancer, gallbladder, breast cancer, pancreas, colon cancer goes up dramatically. If you're a male, esophageal, colon, liver, prostate, pancreas cancer, all those risks go up as well. So we need to try and prevent obesity. Now, I have a lot of obese patients that I operate on. As I said, the standard BMI now is overweight, if not obese. This here is a CAT scan of a patient. And what it is, you can see that you have the little white areas that you can see here. That there is the abdominal cavity if you're looking at a person front on. What you see around it, that's all the fat tissue. And I have my patients say, but doctor, you don't understand, I'm just big boned. I'm a large person, I'm big boned. You can look at these scans, it's not the case. You're not big boned. Unfortunately, this is a cross section here. These white streaks, those are the pelvic bones. They're teeny. If you look at how big this patient is, very teeny, very small skeleton. So yeah, obesity is rampant. Now imagine if you're a surgeon and you're trying to do surgery on somebody that's obese, trying to find the gallbladder in somebody that has a big abdomen. It gets very challenging. This is a picture of surgery, looking for a gallbladder. Now what you're looking at here, you have liver up here. This is the gallbladder here. It's almost buried in fat, okay? It makes things much more difficult. Chances of complications go up when you have an obese patient, primarily because you are working so hard to even just get to the dissection planes that you can easily see in somebody that's not obese. The other side effect of obesity is fatty liver disease. This is that same patient, and you can kind of see right here, the liver is getting replaced by fat cells. And what happens is once you get replacement of your liver cells by fat cells, this progresses. You get what's called liver fibrosis, and that progresses to cirrhosis. Anybody know what cirrhosis is? It's florid liver failure. Experts predict that by 2050, that's not long from now, 2050, the leading cause of liver transplants in this country will not be liver disease or hepatitis C anymore. It will be from fatty livers. Fatty livers progressing to cirrhosis. This is completely preventable. Liver transplants, huge surgery, a lot of chances for complications. Not a surgery I would wish on anybody. So, what I just told you, there's literature to back it up. Your BMI, your body mass index, predicts your operative time. If you have more operative time, you have higher risk of complications, bleeding, wound infections, problems afterwards. And then again, the effect of visceral obesity on surgical outcomes. This paper was just published. Essentially, they're saying that if you are obese, you increase your chances of bleeding, wound dehiscence, which is wound separation, wound infections, and heart and lung complications after surgery. So obesity, it's a funny thing. It's a self-feeding circle. You know, you have reduced appetite control, you have reduced self-esteem, and the circle just feeds on itself. You get increased energy intake, you get excessive weight gain, and the circle just feeds and feeds on itself. Because you've gained weight, you're less active, you can't control your appetite, and you eat more, and it just goes and goes, and it's a very hard cycle to break. So The Blue Zones is a book about people that live the longest on Earth. And Dan Buettner, the author, went around trying to figure out why. What did these people do to live the longest? And one of the things he found was this. This is in Okinawa, where they have the highest number of centenarians, people that live over 100, the highest number in the world. And they live by this principle. Essentially, what it means is you stop eating when you're 80% full. That's what the saying means. So they live by this principle. The old days when I was growing up and I was told to eat all the food on my plate or else you can't be excused from the table, I think those days need to be over. We need to change that thinking. When we start to approach full, we should probably stop eating. Number 6, interrelated again, have more fiber in your diet. This decreases your risk of constipation, decreases your risk of hemorrhoids, decreases your risk of diverticulitis. So fiber, it's been nicknamed the broom that sweeps the colon clean. Remember the studies that I talked to you about red meat and the direct link in colon cancer and red meat? Well, they're doing a new study now. And they're taking people eating red meat and fiber and seeing if there's still the same link between colon cancer and red meat intake. And the funny thing is the preliminary data shows that there's a decreased incidence of colon cancer if you take fiber with this food that we know causes colon cancer. So the broom that sweeps the colon clean is a very good name for what fiber does. So it lowers your incidence of hemorrhoids, certain cancers. Colon, breast, and prostate cancer studies have shown that the increased fiber intake decreases the incidence of these cancers. It lowers your incidence of obesity, heart disease, high cholesterol, and hyperglycemia, so diabetes. Quickly going to touch on hemorrhoids. I see a lot of hemorrhoids in my practice. Over 3 million cases in the United States annually. It may not be a top killer of Americans, but it definitely causes a lot of suffering in Americans. Some history, which I find very interesting. This quote comes from John of Ardenne in the 1300s. He said, "The common people call them piles, the aristocracy call them hemorrhoids, the French call them figs. What does it matter so long as you can cure them?" And he's so right. Hemorrhoids, they have caused so much suffering through the ages. There is artwork about many things, but not so much medical, with the exception of hemorrhoids. So what are the risk factors of hemorrhoids? Well, we talked about the big one, fiber, constipation. There's other things we cannot control. Pregnant women that have increased pressure on their varicosities down there, people that have other special situations, people that spend a lot of time sitting have a higher incidence of hemorrhoids, okay? But all in all, we can prevent it with the fiber, the avoiding constipation, we can prevent hemorrhoids. Also associated with fiber, diverticulitis. This is something that affects 200,000 to 3 million. That's a big number, but a lot of people in the US annually. It's a disease of Western civilization, and there's a strong correlation to a low fiber diet. So what is diverticulitis? They're these little outpouches in your colon. So if you look here, I know this picture is small, but you can see the colon coming around, and these little outpouches. These are diverticula. These little diverticula over time can get inflamed, become very painful, and sometimes can even rupture or cause bleeding, which is a surgical emergency. Autopsy specimen of diverticulitis, same thing. They're these little outpouches, okay? Now, when it becomes a surgical emergency, I have to take these patients to the operating room. We end up removing the part of their colon that's diseased, and a lot of times we have to give them a stoma, or what's called a colostomy. This is something that is not pleasant to live with. It's something that's completely avoidable, basically by a high fiber diet. That EPIC group, the same group I keep talking to you about, they researched that and diverticulitis. What was their evidence? And what they found, consuming a vegetarian diet and high fiber were both associated with a lower risk of either being admitted to the hospital or death from diverticular disease. Strong evidence, fiber decreases your risk of diverticular disease. Okay, we're down to 5. More constant blood sugar levels, you can avoid diabetes and the complications of diabetes. You might think, well, I'm a surgeon, why do I care about diabetes? This is a medical problem. It's absolutely not. I see so many surgical complications of diabetes. This is something that I frequently have to, unfortunately, operate on. So risk factors, they're the same as many of the other things. Cardiovascular disease, high blood pressure, being overweight or obese, high triglycerides, smoking, alcohol intake. Sound familiar? I feel like I'm repeating myself. It's all the same risk factors. So another study, of course, this is by Neil Barnard. He looked at vegetarian and vegan diets for treating type 2 diabetes. Diabetes prevalence, as you can see here, the vegans are the blue, that turquoise blue on the right. Their prevalence of diabetes is the lowest out of any dietary group. Another study out of 60,000 people showed pretty much the same thing. Vegans have a lower incidence of diabetes. So complications of diabetes, 68%, almost 70% of people have heart disease. We talked about heart disease already. Kidney function, 40% of people have kidney disease, renal failure, are on dialysis, or need kidney transplants. And then neuropathy, this is a big one. 60 to 70% of people have neuropathic pain, chronic pain, due to diabetes, loss of sensation. When you have loss of sensation, you cannot feel your feet, so your balance is off and you fall. Or, heaven forbid, you bump your toe and you don't feel it. It can progress to a very, very severe infection and need for amputation very quickly. This here is a diabetic that came in with what we call necrotizing fasciitis. This is a flesh-eating bacteria. If only it was plant-eating. A flesh-eating bacteria. So these bacteria travel very fast. This is a surgical emergency. Patients die from this all the time. It's something that can be easily prevented. More studies. Low-fat vegan diet, it's going to control diabetes. People get off of their diabetic medications once they switch to a plant-based diet. When you look at this graph, so hemoglobin A1C is one of the measures we use to see how well people control their diabetes. On the x-axis, we're looking at weeks. Okay, weeks of this trial. And this person took a group of vegans and then took a group of conventional people, and he just monitored their A1C. The conventional people were even on diabetes medication. And what he saw, as you can see, the solid line on the bottom, that's the vegan. They had the lower hemoglobin A1C. They had better results than even treating it with medication. So number 4. This one addresses the most common surgery that I do. Any idea what the most common elective surgery in the United States is? Gallstones, gallbladder disease, removing the gallbladder. So if you decrease your cholesterol intake, you're going to decrease your gallstones, you're going to decrease your chance of gallstone disease. This is a gallbladder that's removed. You can see it's cut open, and inside are these stones. These stones are what causes the whole disease. You might want to ask, what are these stones? How does this happen? Why do we get stones? Well, I found a paper called Manufacturing a Gallstone. And when you look at it, basically a bunch of molecular pathways, but all in all, it's an imbalance between bile acids and cholesterol. Too much cholesterol outweighs the balance with your bile acids and causes precipitation and gallstones. So, makes you wonder, could a plant-based diet be preventing gallstone formation and gallbladder disease in the first place? And that's absolutely true. We're on to number 3. Decreased degenerative joint disease and the need for joint replacement surgery. Many people as we age need joint replacement surgery due to arthritis, osteoarthritis. Anybody want to venture a guess as to one of the most highest risk factors for osteoarthritis is? We haven't studied that one yet. It's obesity. So it could be linked to many other things, but obesity as a whole is one of the most strong, has the strongest association with degenerative joint disease. So studies show whole foods, plant-based diet, it alleviates the symptoms of osteoarthritis. So basically, your symptoms, your quality of life can be better, even if you already have arthritis. And here's another review article. It's talking about prescribing nutrition, physical activity as your first line for the management of arthritis and the inflammation associated with it. So arthritis is an interesting thing, okay? You have the osteoarthritis, which leads to many things. Who knows whether it's a cause or a result of the overweight and the obesity, because you become less active when you have arthritis because it hurts to move around. When you have the physical inactivity, you're going to have altered biomechanics, joint stiffness, joint pain, and this chronic low-grade inflammation. We know inflammation is not good for you, and it causes progression of the disease. So this is something, if we can control our BMI, we can decrease our obesity, we can decrease the inflammation associated with osteoarthritis. On to number 2. This one I thought was very important, but it's different. It's not absolutely soundly medical. Have more radiant skin, feel your best, and have excellent self-esteem. To me, this is huge. How can you avoid the scalpel? By having more radiant skin, feeling your best, avoiding all this stuff? Well, this one's pretty obvious, diet and acne. They actually reviewed this, and they looked at risk factors associated with acne. And yes, you can see high glycemic load diet is associated with acne. Dairy, skimmed chocolate or total milk is associated with acne. Chocolate, thank goodness, is inconclusive. Salt, you have iodine, no, those are not associated. And then fatty acids, inconclusive. So there is a strong evidence or a strong correlation between dairy and this high glycemic load diet. People are undergoing surgical treatment for obesity, for self-esteem. And you can carry that even a step further. You know, people who are really referring or always constantly going to a plastic surgeon to try to improve their outlook when it's something where you can fix with more radiant skin, more self-esteem, etc. So I would argue that's a very important point. And then the number 1 reason, this is my favorite, the most exciting reason, the most research that has recently been done on this is just phenomenal. It's epigenetics. Has anybody heard of epigenetics? I never heard of it. They didn't teach me this in medical school. This is brand new stuff, and it's fascinating. You can pass your health on to your progeny. Would you have ever thought that decisions you make today are going to affect your children's health and your grandchildren's health? They absolutely do. We just haven't been able to prove it till now. So epigenetics, the formal dictionary definition, it's the study of changes in organisms caused by modification of gene expression after alteration of the genetic code itself. So this is not altering your DNA per se, this is alternating your DNA expression, picking which proteins in your DNA get expressed and passed on. So many pathways that we're talking about here, histone acetylation, all these places are new targets, and they're new targets for promising cancer prevention strategies. This is the new frontier of science, and it's very exciting. When we look at the chromosome, up on the left, we have epigenetic mechanisms up here. So we have development, in utero childhood, we have chemicals we're exposed to, things like your diet and how that changes things, aging, drugs, pharmaceuticals, and then you have to ask, how does that change what we do? You can follow this DNA expression all the way down to the histones, which is how the proteins are expressed and regulated, all the way down to changes in how your DNA is actually expressed. And it's a very complex subject, but it's very fascinating because the endpoints of this are cancer, autoimmune disease, mental disorders, diabetes. These are all targets that can be targeted with changing things up in the beginning, such as chemicals you're exposed to, aging, and diet. So very complex. I hope it makes a little bit of sense to you guys, but it's a very fantastic and exciting field. And the thing about it is it's transgenerational. So this is a recent study. There's a little town in Överkalix, Sweden. I've never been there, never heard of it till I read this paper. But what happened there is very interesting. There was a famine in the early 1900s, severe famine. People were starving. And they took this group of people, they followed them, and they followed their children, and they followed their grandchildren. And they wanted to see what happened as a result of this major life event. What they found is that these people's grandchildren were less likely to die of cardiovascular disease. Now, this is a very strong example. It's maybe exaggerated because these people were starving. But what it does is it suggests that there was epigenetic inheritance, meaning that this is passed on to your progeny. This is a huge idea, something that is, again, very fascinating. Those are my 10 ways, just talking about the exciting things on the horizon, how we can avoid the scalpel. Hopefully you guys have learned something. I'm happy to entertain any questions. One thing I do want to say briefly, so obesity, everything's interrelated. You have the obesity, you have low fiber, you can see it's a Venn diagram, everything overlaps. You have constipation, which overlaps with the low fiber and obesity. You have hemorrhoids, which overlaps with all of that again. You have diverticular disease, same thing, relates to low fiber, constipation. Cardiovascular disease, all of the above. And it goes on and on and on, and you can see that a plant-based diet has so many ramifications for your health. It is actually mind-boggling. Now, one of my favorite guys, Michael Greger, he came and talked a little while back. He has this quote, and this applies to medicine in general and people. He says, "Oh, patients won't improve their diets or stop smoking, even if it's going to save their lives, so why bother?" Well, the answer is this. That attitude may be one of the true leading causes of death. And he's right about that. We have to have this attitude, at least from a medical perspective as well. We have to be counseling our patients on diet. We can't have an isolated conversation about your gallbladder and your gallbladder disease and not talk about diet. Again, many thanks. A lot of these people on this slide are giants in the field of plant-based work. And I'm proud to have talked with them about many things, and they're people that continue to inspire me. So again, many thanks to all of you for coming, listening to my talk tonight. I very much appreciate it, and I'll be happy to answer any questions you guys have.
Thank you very much, Dr. Irminne Van Dyken, for a really wonderful presentation, and you got some really nice photos at the end as well. Thank you all so much again for coming. Mahalo. Have a safe return home. Good night, everyone.
This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.